So we'll update you on the latest numbers in the state of California. We will walk through some new announcemements, and then, of course, here to catch up, answer any questions. Current number of people that tested positive in the state of California is 335. That's a 14% increase from the prior day. Tragically, we now have 6 individuals that have passed away from COVID-19, the novel coronavirus. The state of California has conducted some 8,316 tests. That includes our 19 labs, of which 2,665 of those tests were done by our labs. But those labs, as I noted a few days ago, have been supplemented by hospitals, from Stanford to a number of UCs, City of Hope, as well as our private lab, Quest, in San Juan Capistrano. I'll remind you that Quest currently is operating just one lab in the state of California and conducting roughly 1,200 tests on a daily basis. That will substantially ramp up in the next week or so with the 2 additional labs that will come online. We'll get those tests just from that commercial lab up to 5,000, as much as 5,500 a day. But the total number north of 8,000, and we are increasing our capacity on an hourly basis, not just a daily basis. Accordingly, we have advanced a partnership that was initiated well over a week ago with Verily, the health and life science subsidiary of Alphabet. We advanced that partnership with the idea of bringing to market the capacity for individuals that have developed mild symptoms or are concerned about their status from the perspective of being in a vulnerable population, be it our seniors or at higher risk of contracting the disease, to give them the opportunity to go on this portal, to answer specific questions, to be scored in terms of their likelihood to be needed to be tested, and then be allowed and directed the opportunity to be tested at what will be at launch 2 specific sites, one in Santa Clara County, one in San Mateo County. That portal, that page that allows people to interface will go online tomorrow, and we will then begin to make reservations, and people throughout the course of next week will be in the opportunity to get the mobile testing that so many are discussing and so many have promoted. We expect that those 2 pilots, one in Santa Clara County, one in San Mateo County, will significantly expand to other parts of the state. We have a deep eye and consciousness on the Central Valley, other parts of the state. We want to make sure, from not just a density of concern, Santa Clara being one of our top priorities as a county, that's the answer to why we're starting there, but more broadly, that we look at the issues of socioeconomics and access as a big part of the advancement of the Verily partnership. We hope that this partnership can scale, and we believe it will be a national model. There's simply no other interface that exists in the United States that allows people a portal that has questions and the capacity to geospatially identify where people are, so we can identify the closest areas for mobile testing that we're aware of in the country. And so we are very encouraged by this partnership, very enthusiastic to finally announce it. I know there's been some conversations about it in the media, but it is going live this week in the next 24 to 48 hours, fully operational in the first 2 piloted areas in our state. We have the capacity currently through the assets in hand, be it swabs, and that's an issue that I will discuss in a moment, the issue of swabs, not just the issue of reagents, not just the issue of RNA extraction kits that are part of our testing regime, but also the availability of swabs. But the first tranche, we have over 9,000 test capacity with the swabs, and we will partner with Quest in terms of the diagnostics of those tests. And the turnaround is typical at Quest, anywhere from 2 days, some cases 3 days is roughly the estimate. People will be automatically notified based upon that screening criteria and based upon that interface on that portal of their test results. If people have severe symptoms, this is not where we want you to be tested. This is just a test. If you have severe symptoms, you need to engage the medical community directly. And so we want to remind people this is not to substitute that interface, but to supplement our capacity to get people that have some mild concerns and or people that are higher risk, to remove them from overburdening our healthcare delivery system, to get them out of that setting and to allow people with the kind of portability that mobile testing provides to get answers quickly. But again, it's just a test. And so I just want to remind people of that framework and not promote it for something that it isn't. So we're moving into the next phase as it relates to testing in the state of California. Broadly, I think in the United States, there's still some capacity concerns, not only on the diagnostic side, on the back end with the labs, both private, public, commercial, but as it relates to supplies, and one must be honest about that and forthright about it, but significant increases nonetheless in the testing protocols are being advanced, again, I think quite substantively with this new partnership. As it relates to the purpose of developing these partnerships, the purpose of our testing, that is to identify through community surveillance where we are, so that we could begin to process how we need to manage the status quo and how we need to anticipate the growth and spread of the virus and look at allocating resources across the state accordingly. I mentioned this a few days ago. I'll remind folks, we have about 74,000 hospital beds in the state at 416 different hospitals. We have surge capacity in our state just shy of 9,000 beds, 8,661 beds to be exact. And that is on the basis of current survey that's very contemporary of the existing hospital system. We have about 11,500 ICU beds in our system, but that's not just for adults. That also includes pediatric ICUs. It's just shy of 11,500 when you add the two numbers up. We have new and detailed information about access to ventilators, over 7,587, not over 7,587 ventilators currently reside in our hospitals, and we have procured new ventilators, a few hundred that we were able to purchase, and we also have our own cash, both through our EMSA and our CDPH sites that include an additional roughly 900 ventilators in addition to the 7587 that I referenced. So I give you those numbers because a lot of people have asked about that information. Those are the most up-to-date and contemporary numbers. I also make that point as a point of consideration and segue to the subsequent announcement. And that is, as we manage this disease and the dynamic nature of this moment, we need to anticipate spread, but we also need to prioritize our focus. And the purpose of today's announcement is to focus on specifically what we mean by that. Most important thing, again, is to protect the most vulnerable, protect our seniors. In the state of California, we estimate we have 5.3 million Californians that are 65 years or older. Of those 5.3 million, 65 years and over, we are prioritizing their safety because of their unique vulnerabilities to this virus. We also are prioritizing those with chronic conditions and prioritizing our homeless. And it's in those three areas that I want to advance some new considerations for the public and new direction for the people of the state of California. We are calling for the home isolation of all seniors in the state of California. We are calling for the isolation, home isolation of all of those 65 years and older and those with chronic conditions. We are doing so with our eyes wide open at the magnitude of what that means. and the need to provide wraparound services to support our seniors in need of medical supplies, in need of meals, and the like. The team assembled behind me, and the people in this, what we refer to as SOC, our State Operations Center, of where we reside at the moment, currently have 13 task forces that are working on a panoply of issues, from logistics, from things as basic as not just food, but water, fuel, and basic supplies, to more complex issues related to workforce and the like. And so we are looking at this from a very holistic perspective and a holistic lens. We recognize that social isolation for millions of Californians is anxiety-inducing, but we recognize what all of the science bears out and what we recognize around the rest of the world, that we need to meet this moment head-on and lean in. Not isolate ourselves to this moment, but lean in and own this moment and take actions that we think are commensurate with the need to protect the most vulnerable Californians. Number two, we are directing that all bars, nightclubs, wineries, brew pubs, and the like be closed in the state of California. We believe that this is a non-essential function in our state. And we believe that it's appropriate under the circumstances to move in that direction. As it relates to restaurants, we have more nuanced concerns and considerations. Some have suggested just shutting down all of our restaurants. We don't believe ultimately that is necessary at this moment. Consideration, nonetheless, is to socially distance patrons within these establishments. And as a consequence, we are directing that we reduce the current occupancy within these establishments by half, and we require social distancing within those establishments. We will provide some flexibility in that space, and we could talk more about what that may look like, but in broad strokes, that is the current directive, and we will in real time absorb the capacity to potentially do more, but also try to reflect on the enforcement side of this, which I'm not concerned about, because as you had noted, with all of our directives, we are seeing a socialization in real time and strong and broad support, not only from the public health officials up and down the state, but the private sector that has done a remarkable job meeting this moment. So that's on the restaurant side. Let me just briefly make this point. There is a concern around access to food for those that cannot prepare their own food. Not everybody has kind of kitchen you or I may have. Not everybody is capable of heating their food. Now we're talking about home isolation. Not everybody is able now to go out the grocery store to get that food. Some may have limited capacity as it relates to deliveries, but we want to expand the points of access to get those deliveries. Restaurants, by definition, provide those points of access. So having an organized construct that allows delivery of hot, prepared, and nutritious food within an existing infrastructure, we think is appropriate, again, to this moment, with the additional steps on bars, nightclubs, wineries, brew pubs, and the like. Number three, in relationship to seniors as our top priority in home isolation as it relates to bars and new guidelines on restaurants, I referenced the issue of homelessness. This is a top concern in the state of California in the abstract. We have 108,000 unsheltered homeless individuals in the state of California. We need to meet this moment aggressively. And I can assure you, I mentioned 13 of our task force teams that are residing in this building. They are our teams just working 24/7 on this issue to get people out of encampments and get people into environments where we can address their growing anxiety and our growing concern about the health of some of our most vulnerable Californians out in the streets and sidewalks. We are in real time procuring hotels and motels to to convert to appropriate sites. We have just identified as just an example. This is not even close to the magnitude of what we are proposing, but it's just a point of consideration and a proof point to give you a sense of what we're doing. We have additional 450 trailers that we have identified that will be dispersing to critical points across this state, and we're working to address the needs within the shelters so that, again, we have appropriate distancing and we are appropriating ourselves as it relates to social mixing for those vulnerable communities as well. So that's another area of deep and disproportionate emphasis that also we are advancing as a directive. As it relates to, again, vulnerable populations, you saw yesterday we put out guidance as it relates to an executive order directing along the lines of what the CDC and others have been recommending. We codified that in the state of California on visitation in our senior facilities, our skilled nursing facilities, our assisted living facilities. We now are tightening those directives to just end-of-life visitation. And that includes hospitals, not just congregate living facilities in the state. So that is also part of what we're advancing here today. So that gives you a sense of some of the current thinking of our healthcare professionals. Again, a number of them behind me. We have our finance team here and others in this building. We are gaming out the financial impacts, not just to the state's budget, but with disproportionate focus on families and individual budgets. This is a very different challenge, a very different crisis, and we need to meet this moment even differently than we did in the 2008, 2009 years. We have to really focus on individuals. So looking at our unemployment insurance, our disability insurance, looking at how we can complement what was done at the federal level. We're also sharpening our focus on what we request of the federal government going forward, as we believe the extraordinary work that has been done by Speaker Pelosi and her colleagues, and we hope soon by the United States Senate, can be complemented with even more support that we think is necessary to meet this moment. In more parochial, for some more pedestrian issues related to our work with the California legislature. We're in real-time conversations with the legislature about our current budget and how we'll process the concerns and anxieties people have about quote-unquote business as usual, an environment where business cannot be as usual, and we'll be making announcements on that in the next number of days, probably within the next number of hours potentially, and certainly tomorrow. On the issue, finally, before I open it up to questions of schools, I want to say this. Current number of schools in the state of California that have already shut down is 51% of all of the districts in the state. That is somewhat misleading number, 51%, because about 80 to 85%, these numbers are dynamic, and we'll get you the real numbers, but we're in that range of 80 to 85% of all of our kids are no longer going to school starting tomorrow on the basis of 51% of the districts shutting down, meaning the largest districts in the state, 24 out of 25 of the largest districts in the state of California have already shut down. The one remaining in that group is Kern High School District, which has remained open. Many smaller districts remain open, and for reasons that are perfectly understandable. And this is something we also want folks to know. On Tuesday, we will be putting out very detailed guidelines for those schools that remained open and continue to remain, and are likely to remain open, and those that have closed. We are vetting and curating and validating all kinds of private and public sector solutions to address the following and obvious real problems. How you feed people that cannot be fed otherwise because they're on free or reduced, not just lunch, but also free or reduced breakfast. Some districts, 80%, some districts even higher, of their children meet that criteria, 60% throughout our entire educational system. It's one thing to say you have a plan. It's another to actually deliver on that plan. And with respect, not everybody that closed had that plan. So we are making sure we supplement that, take responsibility to meet that moment. That's a transportation issue. That's a logistics issue. That's a siting issue, parks, libraries, where we provide those supports. We're also working with the private sector, and I must call out Chef Jose, who was there at the Grand Princess and is here in this conversation, working with his organization to provide nutritious meal alternatives as well, and to help us with the logistics and the distribution of food sites throughout the state of California. But we have particular concern, in addition to that, for special needs children. And this is something personal to, I know, all of us that have any empathy and capacity. As someone whose mother worked for aid to adoption of special kids, this is how I grew up, with a deep consciousness and mindset for those with physical as well as cognitive disabilities. Those children don't have places to go. We take for granted that so many of these kids are going to be taken care of, when in fact they're not going to be taken care of to the degree they should be. And so we are paying particular emphasis on those with special needs and making sure we meet this moment in the community. Child care more broadly defined, and we believe in quality child care, not just access to child care, what that really looks like. And so that's what this planning process has been about. And you may have noted just a few days ago, we initiated, I put some information out on the initiation of that planning process. On Tuesday, we will lay out in detailed terms what that vetted and curated process and the protocols we want to establish look like from a very bottom-up, not top-down perspective, meaning districts in rural parts of the state operate very differently as it relates to community assets than some on the coast with large social safety nets. And so we have to meet the needs of all of our diverse communities. Remember, in a nation state with 6+ million children, and I should just note, the first 6 states that announced they were shutting down their education system combined didn't even have as many children as we do in the state of California. It gives you a sense of the magnitude of the number of children that we are needing to address, that again puts a real burden on trying to orient an appropriate response to meet this moment. The superintendent of public education been working very collaboratively with us, our health and human service agencies, and our logistics teams that also are represented in those 13 task forces that are included upstairs and in that total package and those numbers that I just referenced. So that's it on the schools, a little bit on our new advisories on bars and restaurants, on social isolation, home isolation for our 65 and older population and those with chronic disease, the Verily partnership that we're advancing, which we're very enthusiastic about and we hope is a model to this country, and then, of course, an update on the numbers of people that currently have tested positive. In closing, we anticipate as these tests significantly ramp up, the number of those by definition, change the numerator, denominator, number of people will test positive. Again, we are just trying to break down how we prioritize those on the basis of need: seniors, homeless, and addressing the healthcare delivery system's capacity to meet the inevitable surge. And on that, I will just make this final statement. We have been in detailed negotiations, and we will be bringing online in the next few days significant assets to help increase the surge capacity of our healthcare delivery system beyond the numbers I just laid out. We have already identified some very large hospitals that we can bring online that currently are not operational, and we could bring online in real time. We are in deep negotiations, and forgive me when you ask which specific sites are there. We are in deep negotiations to secure those sites. As soon as they're secured and the negotiations are complete, within the next number of days, we will announce those publicly. We are also looking on the basis of the work we're doing to triage the situation, not looking at the world in the aggregate, but looking at the world as it exists within our diverse communities, meaning we may have a system that includes some 74,000 hospital beds, but not every community has adequate number of beds. So we are looking to site our focus and our energies to increase capacity in those communities that need it the most. So it's, yes, north and south, but it's also from a regional basis, looking at other parts of the state, particularly the inland part of the state, not just in coastal California. But we are very encouraged, I am in particular, and I think I could say this on behalf of Mark Galley and others, by the advanced negotiations on sizable assets that could be brought online, hundreds and hundreds. In fact, I can say this, minimum 750 beds that we'll get up if these negotiations are successful just by the end of the week in world-class settings. And we have identified many other additional sites that we're also initiating conversations. And I will conclude on that frame to also acknowledge philanthropy that's been incredibly supportive, some of the largest businesses as well that are helping us identify those assets and are procuring resources in a resourceful mindset to help us with the formalized leases and potential purchases of some of these assets in real time to meet this moment. So that's where we are in broad strokes, and we're happy to answer any questions.
Governor, you said you were issuing a directive about bars and nightclubs and restaurants,
yep,
and as well as nursing homes. Is that an order by the governor of California by force of law? Or
it's exactly the same guidance we put out as it relates to social functions that are non-essential north of 250 and those that are non-essential for vulnerable populations of 10 or less. What happened, you saw, is it was overwhelmingly positively embraced. Some communities even went further. We have absolute expectation this will be socialized in real time. We've had the privilege of talking to many, many mayors today and county leaders that are hopeful we were moving in this direction. And I have all the confidence in the world. This guidance along the same lines that we advanced on large gatherings will take shape.
The governors of Illinois and Ohio ordered the closure of...
Yeah, well, we could do that easily.
Why not exercise your authority?
Because it's a nuance and a distinction we get caught up in, because to date we haven't needed to do that. We've set out guidance. That guidance has been met in every circumstance. And as I said in the past, if you want to establish a framework of martial law, which is ultimate authority and enforcement, we have the capacity to do that, but we are not at this moment feeling that is a necessity. And to the extent that people do not socialize and support this very directive guidance, I would be surprised, and we have all the confidence it will be.
So, Governor, it's not enforceable, or you don't plan to enforce it?
I'll repeat, we had this exact conversation with many of you as well last week when we put out the guidelines as it relates to non-essential events. You saw in every part of this state, those guidelines were followed. I have all the expectation in the world the guidelines will be followed on this. The same thing that I said then, I'll repeat what I just told Phil just a moment ago. We have the capacity to enforce if necessary, and that is a signature. It's simple.
Sir, what about the state workforce? Sending people, letting people telecommute, sending people home. You know, we've been writing about DMV offices crowded with people getting their IDs and so forth. What about that?
Yeah, so we have very specific directives to our HR teams on Tuesday, just coincidental to the socialization of these new protocols and plans for our schools. They'll be coming out with new detailed recommendations on essential versus non-essential state workers. Now, I distinguish between essential and non-essential, and wherein there's some ambiguity of what's essential, what's not, and that's why our departments are working to really line up some more, I think, strategic thinking along those lines. But you're already seeing a large number of our state employees already telecommuting. I mentioned a few days ago agencies like CalPERS and others. We had our future work commissions already, again, working virtually, but working collaboratively nonetheless, but not in congregate settings. So it's already taking shape, but all of that will be at scale formalized in about 48 hours.
No, go ahead.
So you're not recommending the closure of restaurants. Isn't that exposing people to unnecessary risk?
Not in social. Not if you're. Look, let's remind everybody of who's most vulnerable. If we're home isolating seniors and those with chronic conditions, we have substantially addressed the needs of the most vulnerable in terms of not mixing and being socially isolated. So you then skew a little younger and healthier in these environments, but we are saying you've got to socially distance. We will reduce the size and capacity of those operations by at least half. We'll require social distancing, which is about 6 feet, tables, but we think they're essential in this respect. We need people to be able to pick up food. We need people to have food delivered. We need the capacity to meet the needs of our population. And let me say this frankly, we need a productive society. I'm not willing to submit that in this moment we can't have cohorts of society being productive, just in a radically different way. And so if you're young and healthy, we know this virus, overwhelming science and data is out. It's important to remind people of that. Young and healthy, you will work through this quite well, that we still can be productive. And to the extent we feel like we have the capacity to deliver for 40 million people their meals, their basic necessities, we may then make additional adjustments. But for the moment, we feel this is an appropriate adjustment.
So exactly how do you get meals to the millions of 65-year-olds and up?
That's what we're working. That's why all these teams have been assembled. It's what we're working on for days. But let me just tell you this. We have well-established protocols in the state. Many of you sat right here with me. Wildfire protocols at scale. Earthquake protocols at scale. This is what we do. And by the way, respectfully, do better than almost anybody else. In fact, better than anybody else. So we have logistics teams, we have scale, and we have protocols as it relates to pharmaceuticals, our capacity to complement local government with state and federal resources. Mark Irducci is running these strike teams that will support the social safety net and those services for our seniors. We didn't walk into this lightly. We're not reacting to this. We've been leaning into this, anticipating this, all part of the protocols that you know well, we have well established through our pandemic plans and through our modeling that is ongoing in the state.
Governor, when other states are closing schools statewide, and these are states that have rural areas too and rural districts, there's a perception that California may not be aggressive enough at this time.
I don't deal in perceptions, I deal with reality, and I deal with reality on the ground. 85% of our kids are no longer going to go to school on Monday. And with respect, I don't think this. I know for a fact that not all these districts have planned for the needs of these kids next week. And I'm deeply concerned about their health, and I'm deeply concerned about their safety. And I'm deeply concerned about their parents' inability to go to work. And many of those parents work in hospitals, work as firefighters, work as paramedics, work as the people that would get in the gear to help us advance the mobile testing throughout the state. And with respect to those governors, they may have figured all that out and may have those protocols in process and be able to answer that in detail. But I can assure you, just last night, I was upstairs just working on foster kids that were working on campus and living on campus that quite literally are ending up in our homeless shelters because there was no plan. And that was related to the system of higher education, some of our most sophisticated folks. So perception, we deal with reality.
Well, is there a benefit for having a uniform state policy? Because we have districts that are off for 2 weeks. My kid's district's off for a month. I mean, is there a benefit for having all the districts being off for the same period?
Last Saturday, we put out uniform standards and guidelines for the state of California. We couldn't be more clear. Last Saturday, we laid out for schools our criteria across the state of California. And it was based upon conditions on the ground. We're not a small, isolated state. This is a nation state. I can assure you what you already know. I'll repeat it just for the purpose of emphasis for those that don't already know this. But Santa Clara County's conditions are extraordinarily different than Tulare, extraordinarily different than Madera or Colusa. And so while it may be fanciful and comforting by perception standards for some to have one size fits all, that's not the world in which we view the reality on the ground. And so there's no community spread in some communities. There's significant community spread in other communities. And so we think it's appropriate on that basis to have the kind of criteria that we allowed and advanced for consideration to be advanced. It had been done a week ago, It was advanced very formally on Thursday and Friday with those announcements, and you'll hear many other announcements over the course of the next few days. But they want superintendents to say, don't shut me down. Help me with these kids, because right now I don't know how to help that child. I don't know how to feed that child. And they're asking us for support. So I could say, you know what? Let's shut you down. You figure it out. Or I can say, you know what? We're going to do this very thoughtfully. We're going to do it deliberately. I prefer to be responsible to the reality, not the perception.
To the extent that there may be homeless people, whether by dint of mental illness or what have you, that don't want to come to the motels or the hotels or the other facilities that you're procuring, do you use the police powers of the state to compel them?
All these things are hypotheticals, and we'll meet the moment. And we have the capacity to encourage people off the streets. We have existing rules and regulations. But I say this with respect, having been a practitioner in this space on the issue of homelessness. I think there's a lot of mythology about resistance. I think it's wildly overstated. And I just don't buy that someone prefers to live in an encampment when they have the opportunity to have a key lock, a door, a house, a place to call their home, their own. I just don't. So I think that is an extreme, and there may be those circumstances, and we'll try to meet people where they are and accommodate it. But I'm not ratcheting up a mindset of enforcement police state at this stage.
I take a couple from the phone as we practice social distancing.
Oh, yeah. But, ma'am, sorry, the guy's behind you.
Is there a timeline for this self-isolation, a guidance with seniors? How
Yeah, it's effective. The guidance is being socialized in real time, effective, correct, right now.
How bad is this recession going to be? I mean, we know how much, we know how...
If I can answer that question.
we know how tax revenues can fluctuate in the state. We've seen them vanish in a hurry in previous recessions.
Yeah.
And obviously, we're headed into a recession. Do you feel like the $20 billion and change in rainy day money is sufficient, or?
Well, we've never been in a better position to weather a recession, period, full stop. Nothing about our current fiscal status is even comparable to Lehman Day, September 15th, 2008, when the macroeconomic wheels fell off during the last Great Recession. We did not have the kind of reserves, liquidity that we have today. So we're in a completely different place. We're in a much better position. I have submitted 2 budgets. Governor Brown submitted 8. It almost, the redundancy of our call of concern extended into my 2 budgets, and that is we model a mild recession that we argue is mild in this bookmark. Less severe than 08-09, but more severe than 2001. And in that modeling, we see a 3-year impact to the state's general fund of $70 billion, which would impact, or rather to our revenue, $70 billion, but impact our general fund by $40 billion. We think within the margin of error, our ability in the current environment to absorb that exists, even with our reserves and our capacity to move things around. That's current environment. To the extent this is more severe, we are better positioned, I think, the vast majority of states in this country, and you're then having a different conversation about federal supports at a level that are even more significant than the modest, $15 billion you received during the last downturn. So.
Governor, follow-up question. California has a very large immigrant population. So back to the schools and restaurants, is it your reluctance to issue more concrete guidance, putting lives at risk, given that many, especially in the immigrant community, take care of grandparents, parents, and other ailing loved ones?
The guidance is crystal clear.
Is it worth
Bars, the guidance is very crystal clear. We are, throughout the state of California, asking all bars, nightclubs, brew pubs, others be shut down for the moment. We are asking that restaurants practice deep social distancing and deep guidelines that include reducing occupancy by roughly half. We see it essential not only for those same individuals that need a paycheck, that desperately need to know that they can feed their own family at home, that we also support them in a very thoughtful and pragmatic way, particularly if there are workers that are younger and healthier, that it should not be in fear of this virus taking their lives. We are separating, in addition to that, all customers 65 and over and those with chronic disease. We don't think, we are guided by the science, health. We are guided in a very thoughtful way, not a framework of hysteria that I think often is the case around some of the decisions that are often made before we think through the consequences.
But isn't it a valid question to ask? You know, healthy people are carriers. They can carry it home if they're carrying.
That's why our guidelines are very clear as it relates to congregate facilities, seniors, making sure home isolation includes all. You have to go back.
Though, like young people who are caring for their loved ones at home. What if they carry it home and then? But
there's no disconnect. We have, as you know, you've been there and written about some of these, I hope, and read our guidelines that were very prescriptive as it relates to mixing, as it relates to those circumstances and how people should conduct themselves as if they have it when they're engaging their grandparents. We've laid these things out in detailed terms. So we've done this very, very thoughtfully. And again, I'm just guided by the experts, guided by all the folks that we're in contact with, not just within the state, at a local level, state level, but our federal partners, and by some international best practices. And to the extent that the conditions change, we will evolve these guidelines, and we think they're appropriate for the time. You said there's someone on the phone?
Yeah, we have a couple of reporter questions on the phone. They will come back and get all your guys' questions in the room. Elizabeth Aguilera asked, what guidance is there for privately run daycares, preschools, other schools that may not be associated with an individual district?
Yeah, so you want to answer more of the details on that?
Sure. Thank you, Mark Galley, Secretary for Health and Human Services. We are working on specific guidance for child care facilities. It is going to mirror very much the guidance that we've given already around through K through 12, and we will be coming out with those very soon.
Got it. Next from the phone, Matt Levin asks, will we issue guidance on evictions or provide additional assistance to help renters who may be impacted by not being able to go to work?
I believe we'll have those out at the latest tomorrow afternoon.
And then last one from the phone, we'll go back to the room afterwards. Thank you for the health folks. Is there any guidance for parents who may be at home with children who've been brought home from school, whether they should be going with their friends, family, getting together? So guidance to parents who may be off school with...
We don't want mixing. We've laid that out. People that have been in existing social cohorts, that's one thing. But mixing those social cohorts is the point of concern. And that's where our guidance over the course of the last few weeks has been very prescriptive. That's been reinforced in guidance we put out on Friday, guidance we put out on Saturday, and guidance I'm putting out today. There's a narrative and a thread that connects what we have done since the beginning of this pandemic. And I remind you, for us, we were front and center on this going back to December of last year, formally with the repatriation of 6 flights from overseas in January. And remarkably, today, through the conclusion of this challenging logistics operation, of which I think we met the moment with the Grand Princess. I should just let you know, to the extent anyone is now interested, the Grand Princess is leaving the Port of Oakland tonight at 7. They're leaving with 300 to, we believe, anywhere from 330 to 340 crew members on board. We were able to get the majority of the crew members onto planes yesterday and today back to their home countries. They have a skeleton crew that will allow them to operate the ship. There are 6 passengers that remain on that boat, foreigners that we are also working to repatriate, but are having more difficulty based upon working with their respective counterparts with the State Department or Consul Generals. We have 75 medical crew that are on board. That's not just their own medical crew, but HSS supplemented medical crew. And it will be anchored in the Bay at an appropriate site for the 14-day quarantine. All the others will have left on flights. The last flight goes out at 6 p.m. tonight.
Correct.
And we have one other flight leaving at 3 o'clock today. And so that should broadly wrap up the Grand Princess. But what it begins is the process of testing all the passengers, And those testing protocols and processes are happening at Dobbins Air Force Base, Laughlin, Travis Air Force Base, and Miramar. And those protocols are being organized through ASPR, CDC, HSS, and those will be providing information with our federal counterparts over the course of the next few days on number of tests, number of tested positive, and how those quarantine operations are going.
Governor, as this pandemic grows more severe in the state, I'm curious what the full scope of your authority is. I mean, do you have...
I have the capacity, you asked, you have the capacity under circumstances, if necessary, to call up the National Guard. You have the capacity under circumstances to call for the enactment of the kind of restrictions that we just advanced to martial law and the like.
Quarantine the state. Can you close the state? Can you close airports? Can you order people to stay in their homes?
Yeah, we have broad authority. I don't want, look, and forgive me, we'll exercise the appropriate authority in consultation with the experts with an eye on public health and public safety. We have scoped out all of the above. We are working in concert, day in and day out, with not just our federal partners, but other states, looking at best practices around the world. We have teams that are in detailed review of what worked, what didn't work in China, work and didn't work in Singapore, what's going on in Italy, what's not going on based upon some of the headlines. Same with France, same with Spain. We have people on the ground, literally, that we're in contact with. They're providing real-time information. We have our legal team that is reviewing all of those questions in detail. We were working with the FAA on flights and repatriation, again, which we already had flight protocols. All of this is part of our all-hazard strategies. This is, for Mark, this is what he does 24/7, FEMA partners. So yes and yes. And to the extent we need to leverage any of those things, we will. But I don't want people to, I get where you're going, and just understand from my humble perspective, we don't need to get there right now, but we're preparing for anything.
You said working with federal partners. How's that going with the Trump administration now?
So,
you've been saying great things about Trump, but you were talking also about not all the test kits were complete, and I'm just curious when you're talking about gaming out as the thing gets worse.
I'm not, I'm sort of beyond the individual frame. I'm working in a more dynamic environment where I'm worried now about access to adequate number of swabs, not just the RNA extraction kits and some of the issues related to the reagents. We're gaming that out. We've been very forthright with the administration and their counterparts on just giving them a sense of where we think that will go and how we can absolve some of the existing rules or redress some of the existing rules that may allow us. For example, some of the swabs, you need to swab twice. Maybe there's protocol swab just once. That will, by definition, double the number availability, working with the FDA and others. So those are ongoing conversations. They've all been very, very positive. We worked hand in glove on this Grand Princess operation. That was a federally led operation, and we worked very effectively on that. The repatriation we worked effectively on. The testing kits, we got another, 8,800. We're getting new kits in real time that are arriving. We have capacity for just shy of 9,000 tests as of today. A little, 8,800 and some odd. So, so far we're in a good place, and when we need something, we are very vocal and very honest and forthright about what it is and expecting in terms of that support.
Thank you, Governor. I've been asked to ask you for people who are impacted from work, who are having to self-quarantine, and employees in these restaurants. Has there been any talk or discussion as far as a rent or mortgage freeze?
Yeah, well, we'll have eviction protocols out tomorrow to address those anxieties. We just had some experts advise us on what worked and didn't work in Puerto Rico related specifically to the issue of mortgages and how there was some relief on mortgages. So there are a lot of things. And so here's what we're doing specifically. We have the benefit of, again, extraordinarily close relationship with Speaker Pelosi. Her leadership is demonstrable. Her success with Steve Mnuchin and others to advance a bill that we expect will be supported by the Senate. We believe it's one of many steps that needs to occur. So we are processing what that means in a state as large as ours. Remember, fifth largest economy in the world, 40 million people. How the UI benefits, how it all works, how it translates to real people. And then we're going to assess the gaps and where the state can assert itself with those gaps and where we need new rules and regulations. All that's happening in real time. I can assure you that's all Keeley is doing in real time with our Council of Economic Advisors and working with the budget team and working with staffs with our congressional representatives, substantively, Speaker Pelosi.
There are some healthcare workers who are 65 or older. Is the directive on them to shelter in place or stay at home or isolate?
Yeah, we're worried about, we worry about our workforce. We worry about the lives of those who are most vulnerable. I'll give you a sense of how many are still working, 70 years old, in the health field. I'll get that information back to you. But this is broadly a directive that includes all Californians.
Senator, have you yourself been tested? And the same for Secretary Galley?
I don't know about any of these folks.
Have you all have been working around the clock? Have you all been tested? And same for the first partner?
We've been, I said this 2 days ago, and I stand by it. Until the most vulnerable are tested, until those with symptoms or higher risk are tested, I don't think it's appropriate when I'm critical of the existing testing capacity to deny that test to someone that is in a high risk. Fortunately, I don't believe I am. My age, relative health. Same with my wife. And that's just another reminder that we have the capacity to still be productive in this society, but we need to protect those that are most vulnerable to this virus. And that is why you need to distinguish. This is not, I think there's a sense, and I've done this a long time, there's a sense everything's black and white, one size fits all, go hard or don't. I caution that. You have to be guided by common sense. And you've got to remember, it's not just the application of a law or an enforcement or directive, it's the implementation of that. And my job is to anticipate the application. And in the implementation, there's a lot of difficult things that we need to attend to. And so as this gets socialized and we see where there's areas to improve in real time, we'll support. But on the issue of being tested, I have not been and will not be tested, humbly, until I show any symptoms and or feel that others have not been appropriately tested.
Can you clarify, is there a plan to get food to these seniors self-isolating?
There are plans being developed. There are plans that are well established as it relates to planning and protocols that have existed for earthquake scenarios, and plans that have been at scale since 2015, one of the worst fire seasons we had in history, until 2017, the worst fire season we had in history, and then in 2018, worse yet. So at scale, the operations center here is a logistics center to specifically address those issues. That's a well-oiled machine. The application course across the state is a logistics operation we've never faced. And so I'm not naive about the challenges, but being able to meet the moment and having a planning apparatus in place, we certainly do.
Do today's changes have any, to what extent do they affect like in-home health care aides who have to go visit the elderly?
Yeah, we're working with IHSS and Home Supportive Services, working with Local 215, SEIU, working with Adult Protective Services. In fact, it was one of the meetings we were having before I felt I needed to come down here because you were all getting antsy and I wasn't down here earlier. I can lay out more specific terms what we're doing for IHSS and others. We have very detailed protocols working with the unions that are uniquely positioned to scale the safety of those individuals and the workers, which we are also concerned about.
Are you worried at all about the casinos? I know a couple have made some announcements, I think, today about closure, but by and large, they're staying open, and I know there are sovereign nation issues.
Well, I talked to two chairwoman last night, chairman of another casino, and they are having an all-hands meeting today. We put out our guidelines. CDC put out their guidelines. We have a nation-to-nation relationship. We respect sovereignty, and they deeply respect that relationship and our broader health concerns. The conversations we've had with the principal leaders of our tribal nations has been incredibly productive. The guidelines, we believe, were incredibly helpful in advancing their decision-making. And as you noted, you have a number, some of the largest casinos in America that have already shut down here in the state of California, card clubs accordingly, and we are continuing to work with these tribal nations. And today is a very important day as they're all convening to tighten up those regulations.
What about movie theaters?
Movie theaters, we laid out specific recommendations 2 days ago. We talked about queuing. We talked about socially isolating individuals or separating individuals. We actually have very prescriptive terms that we laid out for theaters. If they want to remain open, you cannot congregate individuals unless they're at least 6 feet apart. That the reservation system is the prioritized situation, or is the prioritized framework to which we would support the theaters remaining open, and we have queuing guidelines, and we laid those out in very detailed terms as well.
Governor, what do you have to say to the complaints of some Californians who say that feds are mismanaging this latest quarantine and travel centers?
Hey, look, we're all doing our best. I'm trying to lead a nation state, the state of California. We're many parts, one body, both the nation itself and certainly the state of California, 58 counties, 1,000+ school districts. And so we are working very, very collaboratively. I'm not pointing fingers. We're trying to solve problems in real time. We're trying to identify problems, anticipate where we'll be in 2-3 weeks. We're running every conceivable scenario plan. If you want a little bit more granularity on that, let me just tell you some new partnerships with Esri, Facebook, with a couple other. Blue Dot, an incredible company that came in looking with AI and big data to analyze travel patterns within and outside of the state. Flights that come in, where people go after they come into the state, so that we can quite literally model spread, so that we're not looking, again, at the aggregate of our healthcare delivery system, but where we'll be stretched by zip code. So we're at a different level in that respect. We're sharing a lot of that with the federal government. They're sharing a lot of their data and support to us. But we're in a mindset of an open hand, not a closed fist.
Governor, there's a strong concern and a lot of, I think, really good discussion about flattening that curve. And there's, I think, widespread concern, at least from the people that I'm talking to, that actions aren't being taken fast enough. And there's a lot of parallels being drawn between what's happening here and Italy being 10 to 11 days ahead of us. And I just wanted you to maybe talk about, is that a false?
No, it's what we do 24/7.
About people, healthcare providers having to decide what people to keep alive and what people to let die.
Look,
What's happening? Is it not?
let's take a step back. Every single thing we're doing, I'll remind you what I just said, and I'll repeat it because it could be helpful. I told you that we have analyzed deeply the best practices and practices that could not be construed as good practices in China, Singapore, South Korea, Italy, Spain, Canada. We're reviewing all of that in real time. I am well aware of the anxiety coming out of Italy, the headlines. That has already been identified before, respectfully, was identified on the national news or international news. And we're running every protocol and scenario. I don't think it's insignificant, respectfully, the announcement we're making today in the nation's largest state, that we are, in essence, home isolating 5.3 million people, seniors, and those with chronic illnesses that are even greater number, that we're shutting down bars and gatherings across the spectrum, that we already had moved to shut down non-essential events of large scale, and cities have followed suit at even smaller scale, that we are putting together these strike teams and protocols to meet the needs of these seniors. And we're doing all that in real time, that we're announcing the entire restaurant industry has got to shut down at least half its operations, and beyond that, make sure they're even adopting social isolation protocols that are best in class. So these are profoundly significant steps in real time, and they're significant steps up from 2 days ago. We may be back here tomorrow, day after, and can assure you I've got executive orders, I've got enforcement mechanisms, I have the capacity to pull a lot of things and bring them to the fore in real time. We're running those scenarios, but no, we're guided deeply by what's happening, not just by anxiety, not just by fear, but a very pragmatic response to meet this moment without creating other unintended consequences. We game out these decisions, not just to meet the stress and anxiety that exists today, but the stress and anxiety we may create by trying to solve those. That may be exponentially worse than what you were trying to solve for. When you can't feed kids, that's a health crisis. When you can't take care of kids that can't take care of themselves, can't bathe themselves because they can't communicate, can't physically walk, that's a public safety crisis. You've got to address those things. And those are magnified by millions and millions of other examples, quite literally in lives all across the state. So that's how we're conducting ourselves.
There's some, just thinking about how, I take your point that you're recommending this as a guidance, but, I was signed up for a half marathon yesterday, and I was urging the organizer and it was over 300 people, and he resisted, delaying it, and the event went on, and the pictures are all over Facebook.
Yeah.
So what in those scenarios, and you can see the same thing potentially playing out in restaurants. I mean,
Yeah. New York is an example of that. So they had guidelines on bars and restaurants, and clearly you saw the news where people were out there, and clearly they weren't being enforced. Governor Cuomo made the point, it's the right point, that it's their job of, in this case, it was New York City Police Department to enforce those things. And we rely on our local partners. These are the rules and regulations. And I'm not a fatalist. I'm not giving up that everybody's not going to fight. In fact, it was rather extraordinary how quickly people moved to embrace our last guidance at scale. There are a few exceptions. But you saw that not only did cities and counties embrace the guidance, they actually brought guidance even down more granularly at the local level. And there was massive number of cancellations, Major League Football, or soccer, baseball, basketball, all these major sports shut down within hours. I'm confident these guidelines will be well received and will be appropriately enforced. And to the extent, again, forgive me, you will not need to ask me again if we identify that's not being, we will do what we need to do, and I'm not worried about it. Anybody else? And you guys, we're on 24 questions, both of you. I can have a private event with the two of you if anyone else has any questions. Yeah. Good, a little balance it, Phil.
Let me tee this one up. I mean, the president a couple of days ago said he doesn't take responsibility
Okay.
for the federal government's
Yeah,
do you take responsibility for the states?
Yeah, I'm the governor of the state of California. I take my responsibility seriously as an individual, as a citizen, as a father, parent, husband, as a leader in my respective role in the community, not just as governor of the state of California. We all have to hold ourselves to some individual account. And so that's my mindset. I think the vast majority of us feel the same way. Individual decisions in the aggregate will determine the fate of this moment. And all of us need to individually take responsibility to meet this moment. And that's why you asked me, do we feel we need to enforce? I think people individually get they need to do the right thing. And by isolating those that are most vulnerable, I think we'll create a consciousness of what this is and what this isn't, and allow us some space to deal with all these logistics and allow us to fill, to the extent there are gaps, in real time.
There's a report out, or a recent report out, that tracked people who were symptomatic but tested negative for the flu, especially up in Washington State.
I'll leave that to Dr. Angel already. You haven't even finished the question. This sounds like a question for her.
The feeling was that may be tracking what's not being tracked by actual testing. I just want to know if you have information about California on that, on data on California as far as that goes.
Sorry, as far as the sorry.
People who are symptomatic, who have the
Yes.
symptoms of the coronavirus, but
Yes.
tested negative for the flu.
So yes, we are tracking that. We're following it. It does look like ILI, which is what it's called. It's the individuals who have these symptoms that are consistent with flu but test negative. We do see those numbers increasing. And we do think that that's reflecting an increase also in coronavirus in our state, as we've seen with the numbers coming out daily. So we are not surprised to see that either. It is an indication of our understanding of where this is going, which is why these orders are so important at this moment to protect those that are most vulnerable. Absolutely.
Dr. Angel, if I could just ask you something that I haven't been able to get, I don't really understand, and talking to some of my peers also don't really understand the mask issue. So it's been recommended that people don't, purchase up all the N95 and surgical masks, etc.
Yeah.
But meanwhile, healthcare workers are being recommended to wear them for their own safety. Is that right? So why would it work? Why would it protect a healthcare worker but not a member of the general public?
So what's so very important about healthcare workers is that constantly they're going from one patient to the next patient, and those patients that they care for are by and large the types of people that we're concerned about for COVID-19. So they're not only protecting themselves from getting infected, because if they get infected, they'll infect the people they're caring for. They're actually protecting the people they care for even more so. So essentially, these are people who are in very close contact with vulnerable people. So it's very important that we make sure that they are fully protected so that they don't also spread it around. Yeah, both ways.
Jessica is the last one.
Oh, I can.
You have one, you're good?
I've got one.
All right, deal. Round it out.
Elaborate a bit on the directive advisory, whatever it is, regarding the limitation of hospital visits to end-of-life care. Is that an advisory? Is that an order? What is it?
Yeah, it's consistent with the guidance we put out yesterday on assisted living, SNFs, and the like. It's consistent with the guidance I put out on non-essential events, large-scale events, consistent with the guidance we're putting out on bars and restaurants, and consistent with the guidance on home isolation. So it is. We expect it will be socialized. We didn't come up with it randomly. We've been working with the industry in many respects, almost universally. I imagine they are expecting it and are already preparing for broadening their enforcement capacity. By the way, it includes, just want to remind you, hospitals as well.
Thank you, everyone.
Thank you, guys.